One of the other examples I'd like to share is one that we're particularly proud of in the patient engagement platform, is the depression priority setting. This entire initiative in Canada and across the world is predicated on the idea of finding out what topics are important to research from a patient's perspective when we're talking about the research side of engagement. And so priority setting is the terminology we use in Canada and in a number of the other countries that I'm aware of, where you try to identify what are those research priorities. And you don't do it by researchers sitting in a room coming up with ideas of what they think is important, but you do it by going out and finding out what Albertans in our situation had to say. And we sent out a questionnaire that was developed by a group, a steering committee of consumers as well as clinicians and researchers. It was a large group, but they came up with a survey that went through ethics, and it was all approved, and it was sent out primarily by social media across Alberta. We did get people from across the country responding, but we did analyze specifically the Alberta responses in this first analysis. We had over 900 questions sent in by social media to the group, who then distilled those down into the top 11 priorities for research. And those priorities then were provided to the government, provided to researchers, saying, here, the priority setting exercise has already been done. Go for funding for these kinds of questions, because this is what is important to Albertans. We did have a big media launch following that to get the word out that this is what Albertans had said, and it was very well received. And this is about depression. That was a very important agenda on our provincial government's focus in terms of health. So this priority setting doesn't have to be done just one way. It can be done using this social media in a very effective way, depending on the group you're trying to access. I'll say one more thing. Another group I am aware of used the internet in a big way to do priority setting with people who were incapable because of their disabilities to come together to a meeting. And it was all done online and very effectively as well. And these are people, young adults with rare diseases, who had great difficulty with mobility. And so we used the social media as well as online platforms to meet with, and it was, again, a very effective way of identifying what their top research questions were. Then these questions can be taken forward, and researchers can know that they are investigating, and researchers and their consumer partners can know they're investigating something that has been vetted already by the community most interested in that topic.